way to look back or where we were last year or the years in the past and what we have achieved in terms of statistical information. Let's take this with a thank you note. Let's take this forward, Anchal.
Thank you so much. Firstly, I would request everyone who are joining in to kindly mute themselves. Thank you. Thank you, ma'am, for such an insight that Antrajal is doing so many particular programs on SDG reports and UNDP. And definitely today, I guess that ma'am and sir would enlighten us with various other thoughts on the same. So now, I would like to welcome our first guest speaker on board with us, Dr. Baljeet Kaur. Over 31 years of experience in the field of medical practice, including voluntary surgical spacing and emergency contraception, comprehensive abortion care, advocacy for safe practices for HIV/AIDS. Currently, at the position of Assistant Director, Office of Directorate, Department of Health and Family Welfare, Government of Punjab. National Award in recognition of outstanding contribution in the field of no scalpel vasectomy in the country by Ministry of Health and Family Welfare, Government of India, 2007. Founder member and General Secretary of NSV Surgeons India, a charitable organization promoting male participation in family planning. Invented a surgical procedure for street dog population control called as MIVAT, minimal invasive vas occlusion technique. And so many bogies in research work and publications, which I think if I start counting, this whole 1 hour would take me. So I can go further and further, on and on. And I guess so we are really excited to hear from you, ma'am. Dr. Kaur would now talk about women's health. Do we care? And as I mentioned earlier, that there are a lot of socio-cultural factors that prevent women and girls to benefit from quality health services. Women face increased vulnerability to HIV/AIDS, unequal power relationships, social norms, potential or actual experience of physical, sexual, and emotional violence. To put more light on the topic of how women can take care of health and are we caring for the women, I would now welcome Dr. Baljeet Kaur with us. Thank you, ma'am. Forward to you.
Thank you, Anchal, for such an extensive introduction. So am I audible to everybody? Okay, that's good. I'm very grateful to that phone call that I received from Deepika ji, and good to see you here, all in the most vibrant colors. So happy meeting. And I very willingly accepted, and I did mention that I'm going to be out, but I've just come out of the operation theater, and at this moment I'm sitting in Pune doing something for the women, that is sterilizing, helping men come forward and take sterilization with Family Planning Association of India at their Pune branch. So, you know, whenever we talk about celebration of a particular day, calling for a particular theme, sometimes I just cannot digest it. Because just a couple of days back, we lost two women. We lost a mother and we lost the doctor also. And the tragedy was that here is a woman who comes for a delivery. She goes to a private nursing home. She gets a cesarean section and she gets twin girls. Then she gets pregnant again. She goes for a cesarean section. She gets a baby girl again. The third time she is pregnant again, and she goes from pillar to post and is finally sent to Jaipur. And we all know the story. We have seen it in the newspapers. And there she's been told that you are supposed to take tubal ligation. Otherwise, we will not do a cesarean section for you. She calls back the doctor there who did her first cesarean section, saying that, can you help me do a cesarean section, deliver my baby without ligating my tubes? Why? Maybe they want one more boy. And in that process, because of whatever reasons, clinical reasons, leaves behind three daughters who are suffering. And the gynecologist is put to so much of trouble that she also dies and her children are also put to suffering. So where is all this, taking us? There is something grossly wrong with the fabric of our society. And when we talk about addressing various issues, I think the first thing we need to address is our behavior change, something that we need to gain as far as the knowledge is concerned. And we need to understand that everything is not about just uh, running after a mirage and reaching nowhere. And this is very painful. It has really disturbed me, and I cannot even explain how many people are disturbed because of that. But we should look at these things as benchmarks, when we talk about gender, when we talk about access of health service to women. So access is in various forms. You may have decided on various programs, you may have decided on various spaces, but those spaces need to be user friendly. So Deepika ji and all my audience here, I do not understand why a woman who wanted to deliver a baby and she had the right to deliver that baby had to die because she was running about from one end to the other and she was forced to take a procedure or whatever was the reason. Now coming to what we offer in our setup and what we talk about, gender is a very big subject and it goes from anywhere to everywhere, where we sit in the workplace and we see it in the environment around us. So we are talking about creating a healthy earth where, I am told what I should be wearing, what I should not be wearing. And so if I wear small clothes, I am bad. If I wear a burqa, I am even bad. If I cover my head, I am bad. So it is the other people who are deciding what is good about me and what is bad about me. So gender issues apart, talking about what is available in the healthcare system. I know Dr. Gagan is here with me and he's going to expand on what is very valuable for women during pregnancy and subsequently. But if we start from the conception, Government of India and Government of Punjab and all the state governments have programs from the day I was conceived in my mother's womb till the day I die. So if I start counting the programs, there is a program for my antenatal thing when I am a mother. So once I am delivered, the baby is taken care for immunization. There is a program for that. There is a program for taking care of screening of the annual screening of every child who is in the government setup in a government school. So we have a Rashtriya Bal Swasthya Karyakram program which screens every child for 30 diseases, every child in a Anganwadi for twice a year for 30 diseases, and subsequently developing referral pathways and seeing that they get treated to the extent that hearing aids are provided, cochlear implants are provided, the surgeries for heart, for cleft lip, all the congenital disorders, or whatever happens till the age of 18, 30 diseases are covered, and rest of them are covered in other systems. When he is growing up, there is a Rashtriya Kishore Swasthya Karyakram program, that is Adolescent Health program, which is not only covering the sexual and reproductive needs of the adolescent health, but also the need for the mental health, the psychological health around, the social health around, and there are 4 pillars to that. Subsequently, if you start talking about the diseases in the system, Dr. Gagan can expand on many of the communicable diseases. He's a master in that. He's the pride of our department, and he's the best in what he's doing. And I mean, he's the star of our department, and I love him for being that. And the non-communicable diseases. See, there's a program for your blindness control, for your deafness control, for tuberculosis, for leprosy, for hypertension, diabetes, cancer, geriatric care, all the programs till such time. For the dental care, there are dentures that are available free of cost. So if I have to put up in very brief, there are national programs and government has provisioning for most of the things that I suffer from my birth till my death. So from my birth certificate onwards till my death certificate, all the things are covered. From my head till my toe, all the diseases for minimum care are covered. And we have, even for cancer, we have registry in Punjab, and we have Chief Minister's program that covers for cancer also. We have the primary healthcare, we have the secondary healthcare, we have tertiary healthcare, but still we have no healthcare. Why? Because we don't have developed the health seeking behavior. If I'm unwell, I'll sit back home and I don't want to go to the hospital. If I go to the hospital, I am not aware of many referral pathways that are available for me, many things that are available for me. And when I talk of all these programs, uh, I must tell you that there is a beautiful network of healthcare workers. And the network consists of all our medical colleges and all our big corporate hospitals, which come in the tertiary care. Then you have the secondary care, which is our district hospitals, the subdivisional hospitals, some of the community health centers where specialists are available. You can seek your advice from a specialist. You have a primary health care where there is a doctor sitting, a qualified doctor who can take care of your diseases, link you to the people who will be available at the secondary care, at the tertiary care. Now, below the primary health centers, there was something called dispensary. Initially, we are all familiar with this word. There were dispensaries in the rural areas, and there are dispensaries in the urban areas. Are we familiar about some dispensaries in the urban areas? Chandigarh is full of them. Even all other cities also have dispensaries for urban areas. I have been in charge of one of those dispensaries for 10 years in Amritsar, and I have spent a decade in primary healthcare, a decade in the secondary healthcare, and close to a decade now at the state headquarters. Now, at the primary healthcare level, in the dispensary level, you have a community health officer. This is a newly introduced mid-level healthcare provider in India, and it was never present in the Indian healthcare system. And all over the world, you hear this word CHO, the community health officer, or practicing nurse. So this community health officers have been placed in Punjab. The 2,950 dispensaries, which were manned initially by some doctor who was once going or not going, is currently manned by a CHO. The mandate of the CHO is to work with two multipurpose health workers, one male and one female. One CHO works for 5,000 population, and the community health officer is supposed to take care of that 5,000 population, which means it's a demographically designed area. Just like you have India, so whosoever falls within India is taken care. Similarly, you have Punjab, you have your districts, you have your tehsils. So the community health officer also has a demographically demarcated area. Whatever number of people fall in that area, those people are enumerated by the multipurpose health worker, male and female. After everybody having enumerated and listed with the community health officer and the multipurpose health worker female, the next step that goes forward is that this team needs to do a regular annual health checkup on all of them. Health checkup for the blood pressure, for the sugar, for pregnancy, for contraception, for whatever communicable malaria, dengue, whatever seasonal things happen, for tuberculosis, for leprosy, and you have to keep a list of high risk people with them. And they have been given computers, they have been given tablets, they have been given computerized forms which they are supposed to fill, and the entire data is available with the dashboard at the state headquarters. Now, Now, when such a beautiful thing is available, we need to do a screening there and develop a referral pathway so that these referral pathways people adopt and they are able to take care of themselves. So this World Health Day, I would request everybody to make it possible to tell most of the people that there are things that are available close to your house. Now, after enumeration of everybody, if the population chooses to choose their doctor outside the healthcare public healthcare system, they are most welcome. Everybody is entitled to go anywhere and take any type of treatment. But those who want to access treatment from the state services, for them the hypertension medicines are available close to their house in that dispensary where a community health officer sits. And this is the latest that, and Punjab has done wonders under the dynamic leadership of our directors and our leadership, that we have all the dispensaries having community health officers and all the things in position. But when such a beautiful structure is available, such a beautiful healthcare system is available, what we need to see is things should flow through that. सारा पाइपलाइन बिछाने के बाद अगर उसके अंदर से फ्लो नहीं है तो we reach nowhere. So all the audience who are here, kindly make it a point that you go forward and try to educate everybody that there is a system that is available for you. And when we look at the mothers, when we look at the women, when we look at the women who are working, and I have been in close touch. We're running another program called Care Companion Program, wherein we are educating the caregivers, the relative who comes with the patient to the hospital. He is also taught how to take care of this his patient back home. So while the COVID was on and while the nurses were going through so much of stress, of one is taking care of the patient, second is having somebody falling sick in their own house, somebody dying in their family, and yet they don't have time to grieve. They have to come every day. So the kind of stress these women have gone through, we designed a wellness program for them, and we designed online 4 sessions in a day. So somebody could join anytime that person is comfortable, 7 a.m., 11 a.m., 5 p.m., 7 p.m., something like that. So women, as far as the healthcare system is concerned, so when Deepika ji asked me, we were sorting out at the heading, I just wanted to say that women's health, do we really care? We don't care at all. One is, we are not designed to take care of ourselves by virtue of conditioning. Not that nature has designed us like this कि हमको भूख नहीं लगती है, हमको खुशी लेने का हक नहीं है. लेकिन नेचर ऐसा रह जाता है कि we are used to doing everything for everybody and then looking after ourselves. So step one, let's all learn that we need to give some time to ourselves, and it's not just the physical health. We have to take care of our mental health spaces also, the psychological health spaces, and like the WHO definition goes, that health is not just merely absence of disease. It's about being healthy all the time and being healthy everywhere. So in our social relationships, the way we are treated by others, this is a very long topic because women and gender, I think we all have to go a long way. There was a time when we had a lot of respect as women in our society, but somehow, when there's so much of cultural mix and lot of people think that liberation is defined in their own terms and various ways. So you have another fragmented and fractured way of looking at what is care. But definitely all the women here, my request would be, uh, maybe we should design a chart for ourselves, and we should have some time that we design for our own selves, do some hobby work, some craft work, something which gives you peace of mind, and also step out of your chair and do some exercise so that you can keep your body fit. And all the men who are listening here, please help all the women around you to become the women that you wish to see, because I am here because my dad saw this dream. He wanted to see a woman girl in me who was the way I am today. So maybe we all need to see women in a different perspective. There is so much that we can keep talking, but I just wish that if my words fall to any ear, and if any ears take it to their heart, and if you can learn how to respect the feelings and respect the space for a woman, that would be very great. And I'd be very grateful to all of you. Thank you so much for having me here. And sorry for my attire. I just pulled myself out of the OT.
Thank you so much, ma'am. It was really
No
lovely.
problem. You were looking great. Yeah. Yeah. Yes. Go on. Yes. Yes. So yes, Dr. Achal, you are losing connection, I guess, right? Monica has a question, and rightly said, Baljeet ma'am. We all who are listening here can take this word forward, and I think with so many programs that our government is running, and that too for us, we need to spread awareness about these programs. And Achal, Monica has a question. Can you please put her through?
Yes, ma'am. Yes, Monica, ma'am, you can unmute yourself and you can ask your question.
Hello, everyone, and happy Health Day to all. I'm currently not in India, but I made it a point that I attend this session, and I really am keen to do my bit in this part. I do want to know the timings that doctors said that they have sessions every day, like 4 sessions, 11 o'clock, 7 o'clock, or whatever. If you could send all that information, so I would want this information to go to the lower section of our society. I hate to say that because we already are divided into 3 sections in our country, but I do want to share that information to the destitutes or to the ones who do not have access to all these programs, if that could be shared. And yeah, all that information that she had shared, is there a way where someone can look at it? Most of our destitutes are not even educated. They don't have access to English. So that's probably one of the reasons all of us, we need to look into that. And if there's ऐसा कुछ है जो हिंदी में हो available सबके लिए, जिसको कि कुछ चाहे एक पेज हो या कुछ हो दिया जा सके, please.
Yeah, Monica, answering the first part of your question is the sessions that we were holding, they were especially for the nurses who are working in our own healthcare systems, because it's not possible for anybody to arrange a session for the entire population and have anybody and everybody plug into it. So we've had these sessions for the nurses who are working in our healthcare system, public health in Punjab only. I'm not talking about all other nurses. And the second part about the literature available, the entire literature that's available in Punjab is in Gurmukhi. It is in Punjabi. And sometimes some of them are also translated in Hindi, but most of them are in Punjabi, and they reach the people in local language. And I'm using English here because I thought maybe there is a mixed audience. But सच्ची गल ये है कि पूरा कुछ पंजाब च ही हुंदा है, पंजाबियां वास्ते ही ਬਣਿਆ ਹੈਗਾ, ਤੇ ਜਿਹੜਾ ਵੀ ਕੋਈ ਪੰਜਾਬੀ ਆ ਉਹਨੂੰ ਤੁਸੀਂ ਇਹ ਦੱਸ ਸਕਦੇ ਹੋ ਕਿ ਅੱਜ ਤੋਂ ਪਹਿਲਾਂ, ਮਤਲਬ ਦੇਖੋ 30 ਸਾਲ ਪਹਿਲਾਂ ਜਦੋਂ ਮੈਂ ਜੌਬ ਜੁਆਇਨ ਕੀਤੀ ਸੀ, ਮੈਂ ਖੁਦ ਇੱਕ ਡਿਸਪੈਂਸਰੀ ਜੁਆਇਨ ਕੀਤੀ ਸੀ, ਤੇ ਉੱਥੇ ਇੱਕ ਡਾਕਟਰ ਸਾਹਿਬ ਬੈਠਦੇ ਸੀਗੇ ਜਿਹੜੀ 5000 ਦੀ ਪੋਪੂਲੇਸ਼ਨ ਨੂੰ ਕੈਟਰ ਕਰਦੇ ਸੀ। ਫਿਰ ਸਾਡੇ ਕੋਲ ਬਹੁਤ ਜ਼ਿਆਦਾ ਡਾਕਟਰ ਐਂਡ ਜਿਹੜਾ ਨੰਬਰ ਆਫ people in this country, उसका ratio बहुत खराब होता गया उस करके एंड नीड जिहड़ी है इंक्रीज होने करके पार्लियामेंट चो एक्ट पास करके गवर्नमेंट ऑफ इंडिया वालों आयुष्मान भारत स्कीम दे अंडर एक इंश्योरेंस पार्ट आया, दूजा हेल्थ एंड वेलनेस वाला पार्ट आया। ਉਹਦੇ ਵਿੱਚ ਅਸੀਂ ਕਮਿਊਨਿਟੀ ਹੈਲਥ ਆਫੀਸਰਸ ਕਰਕੇ ਇੱਕ ਨਵਾਂ ਕਾਡਰ ਇੰਟਰੋਡਿਊਸ ਕੀਤਾ। ਸੋ ਮੇਰੀ ਇਸ ਗੱਲ ਨੂੰ ਰੇਜ਼ ਕਰਨ ਦਾ ਮਤਲਬ ਇਹ ਸੀਗਾ ਕਿ ਅਸੀਂ ਵੀ ਆਰ ਨਾਟ ਫੈਮਿਲੀਅਰ ਵਿਦ ਦਿਸ ਟਰਮੀਨੋਲੋਜੀ। See, ma'am, Anjal is sitting in Fortis. She may have never heard of a community health officer in India because in our systems, this word never existed earlier. For the first contact for my disease was either the ANM in a village or it was the doctor. So now we have a community health officer where we can go and get, definitely that officer is not given prescription rights, but we have taught them diagnosis and some small prescriptions, some minor ailments they are allowed to give. There is a TOR for that. They are given some kind of access to some medicines and dispensation. Subsequently, when she goes to when I go to district hospital, I get my blood pressure corrected, I take my medication and I come back home. Everybody put your hand on your heart and tell me how many of us actually follow our own blood pressure. Our parents follow their diabetes and their blood pressure regularly. We hardly do. We only go when we fall sick. And I have seen with my parents, they will say, ठीक है, कोई जरूरत नहीं है, चले जावांगे डॉक्टर को. But now that with people knowing that सिर्फ एक BP check कराने ਲਈ ਮੈਨੂੰ district hospital ਦੀ line 'ਚ ਲੱਗਣ ਲਈ ਜ਼ਰੂਰਤ ਨਹੀਂ ਹੈ. ਮੇਰੇ ਘਰ ਦੇ ਕੋਲ somebody can do that and tell me that this medicine is going well with me. After that, if I find that there is a variation in my blood pressure and my sugar, see, we have so many dialysis units. We have so much of morbidity because of diabetes and hypertension, and the entire cardiology setup in north of India. It's because of uncontrolled things. So the idea in public health is to make, to live healthy, to make it feasible to live healthy. So I think I've answered both of her questions. I hope she's satisfied with the answer.
Yes, you did. Yes, you did. Thank you.
Thank you.
Yes. Anyone else who have any questions, they can raise their hand if they have any question for Dr. Baljeet Kaur. And I think till then, I just want to say, ma'am, that as you mentioned in the very first line when you began, that there's something very wrong with the society. So I think the one thing which is very, very wrong, one thing which is, I think, very, very wrong, as you mentioned, is that people have actually not developed a health-seeking behavior, which I think I agree with you, because while I'm also working in a hospital setting and coming from a psychology background, I work as a counseling psychologist here. So I think people are not educated about a lot of things, about the networks that you talked about, that there's so many things available right in the corner, close to their places. But I think we're not educated enough about the same, that we can actually find those people, as you said, the term, the community health officer. So these are particular things that I think, yes, we need to get up, we need to check out, we need to develop more of the insight around us and around our surroundings. And the one thing that, again, you mentioned that you guys started a wellness program for nurses. So I think actually it was a need of our at that time, because nursing was actually getting a lot of stress on those time periods. When I used to personally meet them, a lot of death cases, of course they see, but on a regular basis 10 deaths achanak se suddenly aap dekh rahe ho, and with the thought process that somewhere down the line it can be my family person too, because it's so much infectious. So I think the mental health hygiene routine is very important, as you mentioned in the last particular paragraph, that you said that a self-care routine is very important, a hygiene maintenance for your physical health, for your mental health, for your spiritual well-being is very, very important. So thank you so much, ma'am. It was indeed a very insightful session, and I'm hoping that all of us are taking few of the intakes from whatever you have mentioned today.
Thank you, Anjal. I have not gone into how women are treated and they are killed and they are so many things about women, but let us all be little gender sensitive.
Yes. Surely. So,
Thank you.
so thank you, ma'am. Thank you so much. I hope no one has any further questions from Dr. Baljeet Kaur so that we can move ahead with our next guest speaker. All right. So moving on to our next guest speaker of the evening, and as ma'am said in the last line, being gender sensitive. So we have on our board with us now our next guest speaker, Dr. Gagandeep Singh Grover, MD Community Medicine, WHO Fellow Dengue and DHF, presently Assistant Director, Department of Health and Family Welfare, Punjab, State Program Officer for National Vector-Borne Disease Control Program, Integrated Disease Control Program, National Viral Hepatitis Control Program, Zoonotic Diseases, publications in 46 national and international journals, member of IAPSM, IPHA, AHCF, and editorial board of Journal of Communicable Diseases, National Technical Expert Group for Viral Hepatitis, Board of Center for Public Health of PU Chandigarh, and so many more feathers to his cap. Dr. Singh will today talk about prevention of mother to child transmission of hepatitis B, a way forward for healthy planet. Indeed, I think an important one for all of us to talk about, for all ladies and families to understand and create a healthier living and lifestyle for the next generation too, by having healthy practices. So on board with us, Dr. Gagandeep Singh Grover. Thank you, sir, and welcome again, and forward to you.
Thank you very much, Anshul. I hope I'm audible. I'm thankful to organizers, this Indian Chamber of Commerce and Industries UT, Deepika ma'am, for giving me a chance to be present among yourselves. Thank you a lot, Dr. Baljeet, for always using so kind and humble words. You're always an inspiration. So, Anshul, can I share my screen? I think I need to be loud. It's disabled. I cannot share my screen. I have a small presentation that will be pictorial for everybody, if I'm allowed to do so.
Yeah, Deepika ma'am, you being the host can do the same.
Yes, just a second. Just a second.
So it was a very nice talk, Dr. Baljeet, as usual, talking about health of women and what department is doing. She has deliberated on all the things. Till the time I get the chance to share the screen. Today, when we are talking about World Health Day, our planet, our health, so most of the talks I have come across, most of the speakers I came across throughout the day, everybody is talking about climate. Since as Dr. Baljeet told, my forte has been, I'm a public health specialist, and my forte has been communicable diseases. And that too, vector-borne diseases to a larger extent, malaria, dengue, and that too have climatic impact. So, but I chose a different topic. I hope my slide is visible.
Yes, sir.
So I chose this topic, like everybody is using climate change, effects of climate change. I'm dealing with a different environment and a climate which is blood, and which is harboring contaminations in many patients, Hep B, Hep C, and other viruses, and how we can know about these things, how health of women are important with these things, and how we can prevent a deadly and a chronic disease, hepatitis B. So my talk will be concentrating on all these factors. This is my favorite slide, where if you look at the 5 fingers, if I come to this, there are 5 types of hepatitis. Hepatitis is basically inflammation of liver. Any inflammation, swelling that is caused in the
Sir,
liver.
sorry, but the slides are not changing.
Just excuse me. Is it fine now?
Yes.
So if I look at this, there are 5 types of viruses, hepatitis A, B, C, D, E. If we take the fingers as 5, A, B, C, D, if we touch thumb and the little finger, these two are waterborne, A and E, B, C, D are bloodborne. So this is simplest thing to understand about hepatitis. 5 types of hepatitis: A, B, C, D, E. A and E, when you touch these two fingers, these are waterborne. These three are bloodborne, and they can be transmitted through blood or contamination. I'm just touching upon another disease which is in our blood, HIV. Will not be deliberating on that, just to show how infective and communicable is hepatitis B as we compare other viral diseases in blood. HIV continues to be a major public health issue, and it is affecting more than 36.3 million lives. PLHIVs, they have to take lifelong antiretroviral drugs, but with newer drugs, antiretroviral therapies, so it is manageable chronic health condition. But still, the prevalence in India is around 0.22%, Punjab is 0.18%, and rate of transmission among from a mother living with HIV to child is 15 to 45%. If I talk about hepatitis C, inflammation of liver caused by hepatitis C virus, most commonly it is unsafe injection practices. When we are using the drug addicts, they share the needles, or the needles which are being used by a quack or a person which is not sterilized. Blood transfusion, which in past before 2001, we never used to do testing for these viral markers. Unsafe sexual practices, infected mother to baby care. Hepatitis C can be transmitted from mother to child, but the rate of transmission is just 5%. Like it was high in HIV, it's 5%. Global prevalence is around 2.5%, India 0.32%, but Punjab 0.5 to 3.6%. If I take just 3% as a midline figure, or 2%, we have a population of 3 crores. If I take it 2%, that means at any point of time, 6 lakh person will be infected with Hep C. But now the drugs are so effectively available, DAs, orally effective drugs, the person can be cured in just 12 to 24 weeks. Unfortunately, we don't have any vaccine for hepatitis C, and we cannot treat a pregnant mother or a young child for it. We have to wait. We cannot treat it that. Coming to hepatitis B, my topic of discussion. It is again a viral infection which affects the liver. It can cause acute, immediate disease or a chronic going on for so many years. Symptoms, when they will appear, it will be just jaundice. We all know that. It is yellowish skin and light colored. Your poop is light colored, fever, fatigue, things can occur. Prevalence among general population is 0 to 20% globally. India 0.95% and Punjab is 0.5%. The modes of transmission, mother to child transmission takes during pregnancy, during delivery, and even during lactation when we are feeding the child. And among pregnant, the global prevalence is very high, 1.5 to 2.5%. India, some states, they touch around 7%. Punjab, the prevalence of hepatitis B is although very low, it's very less in pregnant, but the importance is the 90% of the pregnant female, they can transfer the virus to unborn child. So when the child will be born, 90% cases, the child can have the disease. Coming to I was discussing this thing, I always say, ਪੰਜਾਬੀਆਂ ਨੂੰ ਬਿਮਾਰੀ ਦਾ ਪਤਾ ਕਿਦੋਂ ਚੱਲਦਾ ਹੈ ਹੈਪੇਟਾਈਟਸ ਬੀ ਤੋਂ 3 ਟਾਈਮਸ ਸੇ ਪਹਿਲੀ ਵਾਰੀ ਜਦੋਂ ਕੈਨੇਡਾ ਜਾਂ ਬਾਹਰ ਜਾਣ ਵਾਸਤੇ ਆਪਣੇ ਪੇਪਰ ਭਰਦੇ ਨੇ ਮੈਡੀਕਲ ਹੁੰਦਾ ਸੈਕੰਡ ਜੌਬ ਵਾਸਤੇ ਇੰਟਰਵਿਊ ਵਾਸਤੇ ਜਾਂਦੇ ਨੇ ਥਰਡ ਦੇ ਗੋ ਫॉर ਐਨੀ ਸਰਜਰੀ ਔਰ ਐਨੀਥਿੰਗ till that time hepatitis B and C, they are not known. We cannot have symptoms. Hepatitis B and C, they give symptoms when the disease is almost 15 to 20 years old. The liver goes into cirrhosis and failure, only then we can have symptoms. So it is very important to understand the disease, especially when the disease can affect the pregnant and it can be transmitted to unborn child. We need to know about and we need to prevent it. Coming to transmissibility of the three diseases from mother to child, it is 15 to 45% in HIV, 5% in Hep C, it is 90% in hepatitis B. So Hep B transmission to young child is the most dangerous part. The sexual transmission is the most common route in HIV and Hep B. It is not so common in Hep C. It is sharing syringes and needles. So hepatitis B is considered 100 times more infectious than HIV. If I compare two spot maps of Punjab, left one is for hepatitis B and right one is for hepatitis C. The darker districts are having more prevalence of the disease and lighter ones have less. Throughout Punjab, we are finding the cases, but the pattern of Hep B and C, they are totally different. Their IVDs and injection drug users have a different pattern. Hepatitis B is getting a different pattern. This is just a small map of Punjab where I'm trying to show the districts where total Punjab positivity, hepatitis B, Barnala and Taran, they have the highest prevalence of hepatitis B. If I go for general population positivity, it is Taran, Ludhiana, Barnala and Sangrur. If I go for pregnant, the data is very less. The initial data trend is showing Ludhiana, Bathinda, Fatehgarh and Mohali where the hepatitis B is very high. Till time, we have screened almost 4 lakh persons of Punjab under the program and just 3,545, they have been tested positive. Currently, we are giving treatment and testing at district hospitals, medical colleges, ART, that is patients, HIV positive patients, IVDUs and Patala. From next month onwards, all these services will be available at 41 subdivision hospitals, ESI hospitals, and ICTCs, where we'll be able to do all the testing and management. If we talk about pregnant mothers, we have screened last year almost 2.5 lakh pregnant mothers. We have got 540 positive. And how and what we can do, I'm just coming to that part. First is awareness. All the pregnant women, regardless of society, regardless of education, regardless of any social barriers, they need to be sensitized about hepatitis B. It can be transmitted from one partner to other, so we need to know. And all pregnant mothers should be screened for hepatitis B. We have started this program now in Punjab that all pregnant women in Punjab, regardless of government or private sector, who are registered under the system, will be screened for hepatitis B and C. And all the testing kits will be provided free of cost by the government for screening. And if a woman is found positive, that's very important to understand. If a person is positive for Hep B or C, the antibody test, what we do is CAR test, it will remain positive throughout life because antibody will remain positive throughout life. But that will not show, and that does not mean that person or the female is infected currently. So all the pregnant women who will be hepatitis B positive, they will be classified as a high risk pregnancy. Why high risk? Because there are chances of transmission to child. And if the precautions are not taken by the treating doctors and the staff who are delivering the baby, and if there is an accidental injury to others, contamination, cross coming with the blood, so contamination of doctor and paramedical staff can also occur. So all hepatitis B mothers, they have to be delivered in an institution. It can be government, it can be private, as per the choice of the patient. But yes, delivery has to be an institutional delivery. So we have already issued the guidelines. So it has to be under care of qualified doctors. And if a pregnant woman is positive, we need to do a viral load test. That viral load test is going to tell us whether the virus is in circulation or not. So count more than 100 is considered as positive, but for mother, when we do the test in third trimester, if the count is less than 2 lakh international units per ml, so we need not start any prophylaxis in pregnancy. So if count is more than 2 lakh, we will start prophylaxis to prevent the spread of infection. For newborn, we have now taken an initiative, the government of Punjab has taken this part, that we have procured hepatitis B immunoglobulin. This is a pre-filled syringe 0.5 ml which contains 100 international units of HBIG known as hepatitis B immunoglobulin. If we inject this to a child within 12 hours of the birth, the rate of infection of hepatitis B is almost negligible. So we can just prevent the transmission of a deadly disease which can become chronic, and it is the most common cause of cirrhosis and liver cancer. So we can save so many lives with just one intervention of injecting a child 0.5 ml of 100 international unit of hepatitis B immunoglobulin. So this will be provided free of cost to all the mother, regardless of again their social stature, their caste, their creed. So all pregnant women who are hepatitis B positive, their child will be given this, and we should give it, and we should educate all. And all these mothers should be educated when the child is born. Immediately, 0 dose of hepatitis B vaccine should be given. So this vaccine, if given, and hepatitis B immunoglobulin given within 12 hours, the chances of transmission of the child is almost negligible. The child can be born without the disease. And this vaccination can go for 6, 10, and 14 weeks remaining doses. And with just simple 2 interventions, if all the pregnant women are aware about this thing, that they need to be tested, if positive, they need to go for vaccination of the child, and then the disease can be prevented. Thank you very much. So that was, if anybody has a question, I'll be happy to answer that. But on this World Health Day, when we're talking about health, it can be changing your lifestyle to prevent non-communicable disease, air pollution, climatic changes. It's very important to understand that diseases which are not known to general public, and so many persons they are already infected, so we can prevent the spread of the disease from mother to child, prevent infection to an unborn child, and save so many lives. Thank you very much.
Thank you so much, sir. It was indeed insightful. I think this is a topic which is, I don't know how many of us actually know about. I personally, of course, didn't have much idea about the same. And I like the idea of the hand that you told me. It's kind of easy to understand. The A and E, the waterborne, and the B, C, D is the bloodborne diseases. And the fact that you told, actually, if someone is having this particular concern, so 96% chances are there that the children can also get this particular disease, for which it is very important for the masses to, I think, educate themselves about the diseases that are in the society right now, whether it's about the physical or any other particular health related concerns, and the preventive measures that we really, really need to take. Because I think हम बहुत certain होते हैं इस चीज में. I think which a particular example that I can share is that yesterday only I went when for my IPD rounds, I met a patient who actually suffered from cancer. And he got to know quite late. He was having particular stomach aches for which he was just having medication. कि stomach ache हो रहा है, अच्छा ले लो, कोई बात नहीं, काम पे चले जाओ. But after many months, when he got a stroke and everything, he got to know that it is basically a cancer and not a normal, stomach ache that he was having. And it actually went too much into, वो इतना ज़्यादा फैल गया पूरी body में कि वो brain तक पहुंच गया, and he's having a lot of clottings and stuff. So I think preventive measures are really important. That if you're having a normal fever, fever and stuff and आपको बहुत दिनों से एक ही चीज चलती जा रही है, तो वहां पे आप सिर्फ एक डोलो और PCM लेकर अपने आप को खुद डॉक्टर नहीं बनाना है हमको. So I think we need to go to a professional. Awareness, screening, confirmatory tests are very important, as you said, and imparting knowledge about the intervention plans and the doses that you mentioned about. So I think that definitely for all of us and for all the ladies out here and their families, it's an indeed important topic to be understood. Thank you so much. And now if anyone has any question for Dr. Garover, they can raise their hands and we'll take it forward. Right.
Yeah, hi, good
I guess
evening.
there are no more.
No, Achal, I'll just put up a question. Dr. Grover, are they like, even in the previous, like when Dr. Baljeet also told about these programs, and now you are also telling us that there is a program which is related and then there are free vaccinations available. What Monica also asked is that, is there any way that the government is communicating it to the audience? Like, is it through newspapers or is it through a website where we as a volunteer, if we want to educate somebody, so how can we do that?
Very right, Deepika ji, what we are doing it, like Dr. Baljeet told, the same way the ANMs, our ASHA workers, CHOs, they are spreading the information. All the pregnant women, they come to sub-centers on Wednesdays. We call it a Mamta Divas. So all the pregnant women, they are sensitized about this thing. But definitely the patients or the ladies which are going to private sector, they may be missing some of the information. So I took the cue when Ma'am Monica asked the question. We have the IEC material prepared. So we also go into that. So we are planning to go for one app where the patients, they can log in and ask about the nearest place to know about the diseases and the test which they need to be asked for, and they can get all these things free of cost. And we are going this year, what we are going to do is we are preparing flip books in flip charts in English, Hindi and Punjabi for the concerned population. So when a patient, the pregnant comes to a place, so you can just educate them about the transmission of the disease and the prevention of the disease both.
Thank you so much, sir. That's a great initiative that the welfare board is taking into consideration. Yes, is there somebody else who is asking a question? Miss Monica, please go ahead.
Yes, sorry to intervene again. I do want to, we have so many sessions, we have so many things happening around. I'm really thankful. I'm thankful to the entire panel who has agreed to be a part of this discussion and also imparting information and knowledge to everyone. But I would really feel that if towards the end of our discussion, we can come down to some chart. I understand that Dr. Saab just said that we are spreading awareness in the form of PDFs or in the booklets. I think what is most important is for them to know where the help is available. Then that of knowing, I'm particularly targeting the destitutes, the people who do not have a lot of information. So the plain and simple information in Hindi or Punjabi, मैंने हिंदी पंजाबी दोनों चंगी तरह आती है, पर जे उस तरह की information लोकां नूं दित्ती जावे. In fact, सानू ही तुसी towards the end जे दो जे ਅਸੀਂ 50-60, I don't know how many people are attending this today. So 50 नालों I think definitely ये 500 लोकां तक ते जाऊगी, because all of us have our WhatsApp groups. ਜਿਹਦੇ ਚ 50-60 ਮੇਰੇ group ਦੇ ਮੇਰੀ WhatsApp ਦੇ I think I can reach up to 3,000 people. I would want all this information to go to everybody who can reach, but the content has to be readable, approachable, and ਇੱਕ ਜਾਂ ਦੋ pages ਦੇ ਵਿੱਚ ਜੋ ਆਪਾਂ discuss ਕੀਤਾ ਸਿਰਫ ਜਿੱਥੇ ਪਹੁੰਚ ਸਕਦੇ ਆ ਲੋਕ, ਜਿੱਥੇ ਜਾ ਸਕਦੇ ਆ, ਕਿਹੜੀ ਜਗ੍ਹਾ ਨੂੰ ਟੱਚ ਕਰ ਸਕਦੇ ਆ. ਠੀਕ ਹੈ, ਜੇ ਹੈਪੇਟਾਈਟਿਸ ਬੀ ਵਾਸਤੇ ਕਿਸੇ ਨੇ ਟੈਸਟ ਕਰਾਉਣਾ ਤਾਂ ਕਿੱਥੇ ਜਾ ਸਕਦੇ ਆ. ਤੇ ਜੇ ਡਾਕਟਰ ਸਾਹਿਬ ਨੇ ਪਹਿਲਾਂ ਜਦੋਂ ਗੱਲ ਕੀਤੀ ਸਾਰੀ ਰਿਗਾਰਡਿੰਗ ਵੂਮਨ ਐਂਡ ਮੈਨ, ਸਾਰਾ ਜੋ ਪ੍ਰੋਗਰਾਮ ਹੈ ਆਯੁਸ਼ਮਾਨ ਭਾਰਤ ਦੇ ਅੰਡਰ ਕੀ ਆਇਆ ਹੈ, ਉਹ ਸਾਰਾ ਐਟਲੀਸਟ ਜੋ ਅੱਜ ਆਪਾਂ ਡਿਸਕਸ ਕੀਤਾ ਉਹ ਸਾਰਾ just that much on a piece of paper, like ਇੱਕ ਜਾਂ 2 pages ਦੇ ਵਿੱਚ, I think that would be the takeout of this session, even though we have had, but ਕਿੰਨੇ ਕੁ ਲੋਕਾਂ ਨੂੰ ਆਪਾਂ ਐਕਚੁਅਲੀ ਗੱਲ ਕਰ ਸਕਦੇ ਹਾਂ, ਆਪਾਂ ਨੂੰ ਕਿੰਨਾ ਟਾਈਮ ਲੱਗਿਆ ਅੱਜ ਸਭ ਨੂੰ ਇਕੱਠੇ ਹੋਣ ਵਾਸਤੇ 1 ਘੰਟੇ ਲਈ. So I want that all to be provided to us instead of just the recording of the session. Whenever it is, that would be great in terms of emails. एक the attachment PDF थी. I think all of us will agree to that, and we can easily share that information based on wherever we can. Thank you. That is all I had to say. It is really thankful. I'm really thankful to all of you for this.
Thank you, Monica. Point well taken. That will be taken care of wherever it's possible. ਇਹਨੂੰ ਅੱਗੇ vernaculars ਦੇ ਵਿੱਚ spread ਕਰਨ ਦੀ ਕੋਸ਼ਿਸ਼ ਕੀਤੀ ਜਾਏਗੀ. ਜਿਵੇਂ ਕਿ ਮੈਂ ਪਹਿਲੇ ਦੱਸ ਰਿਹਾ ਸੀ, from next month onwards, go to any hospital of the state, from sub-center up to medical college. 2951 sub-centers, 522 PHCs, 100 PHCs in urban areas, 152 CHCs, 41 subdivision hospitals, 23 district hospitals, 3 medical colleges. This test, hepatitis B and C, is free of cost.
I think
Sir, मैं ये कहना चाह रही हूँ, I understand अपनी गवर्नमेंट बहुत कुछ कर रही है ना, किसी भी मैंने बहुत सारी इंफॉर्मेशन देती है, but what I'm trying to say is लोगों तक पहुंच भी नहीं है वो, मतलब 50 ਆਪਾਂ सोशल मीडिया ਦੇ थ्रू सकते हैं. That's all I'm saying.
Monica, I got your point.
Dr. Baljeet wants to say something.
Yeah, Dr. Baljeet.
Yeah, I'd like to answer her question. Very soon, Department of Health is also making its presence on the Facebook, on Twitter, on other places. And on Facebook, we have a very dynamic director, and Dr. Gagan is our star performer and our star of the department. We are getting together and designing. You see, we also realize that the conventional posters and the kind of listing that ma'am is also asking is not what people are seeing today. So what we are designing now with in our department is we are going to have our presence in social media, Facebook, Twitter, other places, and small videos about all the programs and details, because our next generation is depending on knowledge from that place. So why not get it from the right people? So that's our humble attempt. Of course, the list that she wants, we can make that and make it available for her.
That'd be great, ma'am. Whatever work you do in terms of snippets, if we get at the end of the training, that would be great. Thank you.
And I would like to just add in, as I said at the beginning of the webinar, that my company is also working for United Nations Development Program, the SDG for Punjab. So again, the same thing, what Monica is asking for, that we make posters and banners and put it all on Twitter and Facebook and other social media. Plus we design PDFs to be circulated on WhatsApp. And whatever was the intake of today's session, I'll try to document it and pass it on to everybody.
That'll be so kind of you, Deepika ma'am. I think it'll be helpful for all of us because it was definitely an insightful session and a lot of learnings which we can definitely give away to other people also around us. And I think, yes, Baljeet ma'am, as you said, that it's that social media presence is very important. And I think I have seen that over these 2 years of pandemic, social media is something which is a great weapon to actually go on to the masses. And, you know, it can be taken in a good form and of course in a bad form. Everything has its pros and cons, but I'm definitely sure that this particular awareness through the social media would take this thing a long way. So thank you so much to our guest speakers and Ms. Deepika. And now I would like to add on that please, Deepika ma'am, come forward and the last token of gratitude to the speakers and to all the lovely audience that have actually come here and captured this particular session.
We actually, it was, but then we are still, you know, we are left thirsty for more. Dr. Baljeet, when I invited her, she said, Ki, Deepika, I think 20 minutes, we would just be able to touch some topic. And now I realize that, yes, these 20 minutes were two less, and we have अंदर से इतनी ज़्यादा होर, in fact हो गई inquisitiveness, you could say, to know and learn a lot more about these programs and what the government of Punjab is doing, and how we 40 people who were attending this can take charge, and whatever programs are being taken up to spread awareness, at least amongst our surroundings, amongst people who need them, like the destitute. Again, we would not like to use that word, but yes, being educated, we have the responsibility on our shoulders to take it forward and educate the ones who are coming to our homes, or maybe we can touch some small localities around us and spread this awareness over there. So we 40 can at least touch 100 people each and spread this awareness to 4,000. So, and it was a wonderful session, Dr. Baljeet. Thank you so much for your time. And I think Dr. Gagan, sir, has left the meeting. Maybe he has dropped off, maybe due to some network issue. So I'll just thank him on his WhatsApp personally. Thank you, Achal. Take over, please.
Thank you so much, Ms. Deepika. Thank you, lovely. Really great to have you all on board with us, and looking forward to bring more sessions on behalf of WICCI Chandigarh. It was a great initiative, Deepika ma'am. Thank you so much for having this webinar and making us learn so many things from so many respected guest speakers on the board. And it was really great, guys, that you were also very active, proactive in asking your queries and everything. So thank you so much, and we'll meet soon again.
Thank you all.